Welcome back to The Elderly Health Physician, the show where we bring you the wisdom of Korean medicine combined with the best of modern science to help you thrive after 60. I am your host, John, and today we are tackling something that affects millions of seniors every single night. Knee pain. Not just any knee pain. I am talking about that deep, nagging ache that shows up the moment you lie down and try to rest. You know the feeling. You spend all day on your feet and your knees feel fine, maybe a little stiff, maybe a little sore going up the stairs, but manageable. You can push through. Then you get into bed, pull the covers up, close your eyes, and suddenly your knees are screaming at you, that throbbing, that burning sensation behind the kneecap, that feeling like someone is pressing their thumb right into the joint. And the worst part is, you cannot find a comfortable position. You turn to the left, it hurts. You turn to the right, it hurts. You put a pillow between your legs and it helps for 5 minutes and then the pain comes right back. If that sounds familiar, you are not alone. Research suggests that more than 70% of adults over 60 with chronic knee issues report pain that gets worse at night. And the sleep you lose to that pain makes the problem even worse the next day. It becomes a cycle. Pain steals your sleep. Lack of sleep amplifies your pain. And here's what most people do not realize. The reason your knees hurt more at night has almost nothing to do with what happened during the day. It has everything to do with what you did not do before you went to sleep. Joining me again is Korea's oldest practicing physician, Dr. Henry Lee. He has spent over 40 years treating seniors and studying the ancient principles of Korean medicine that have kept generations living strong. Doctor, welcome back.
Thank you, John. It is always good to be here. And I have to say this topic is one that I see in my clinic every single week. Patients come to me and they say, "Doctor, my knees are fine during the day, but at night I cannot sleep." They think something is broken. They think the cartilage is gone completely. They think they need a knee replacement. And in most cases, what I find is something much simpler and much more correctable than they ever imagined. Let me explain why nighttime is so different. The knee is not just a hinge, it is one of the most complex joints in the human body. It is surrounded by muscles, tendons, ligaments, and a capsule filled with fluid. That fluid is called synovial fluid, and it acts like oil in an engine. During the day, when you walk, when you stand, when you climb stairs, that fluid circulates freely. It keeps the joint lubricated, it keeps the cartilage nourished with oxygen and nutrients. It cushions every movement. But at night, when you stop moving, that circulation slows down dramatically. The fluid becomes stagnant. The joint stiffens. And here's what most doctors will not tell you. Inflammatory chemicals that your body produces naturally, things like cytokines and prostaglandins, begin to accumulate around the knee because there is no movement to flush them away. Research has actually shown that inflammatory activity increases during nighttime hours, and that is when the pain hits. That is why you feel nothing at 3 in the afternoon, but you feel everything at 3 in the morning. A study published in the British Medical Journal found that up to 70% of people over 50 with chronic knee pain show radiographic evidence of osteoarthritis. But here's what the study also revealed. The severity of the damage on the scan did not always match the severity of the pain. Some patients with mild wear had terrible nighttime pain. Others with significant cartilage loss slept just fine. The difference was not the joint itself. It was what those patients did in the hours before bed. And that is exactly what I want to talk about today. There are 3 simple exercises that I give to my patients. 3 movements you can do in your bedroom with no equipment in less than 10 minutes. And if you do them consistently before bed, you will wake up with less stiffness, less pain, and more freedom in your knees than you have felt in years. So let me walk you through them. The first exercise is what I call the seated knee extension. And the reason I start with this one is because it targets the quadriceps, which is the large muscle group on the front of your thigh. Most people do not realize how important the quadriceps are for knee health. When your quadriceps are weak, your knee joint absorbs more impact with every step. The muscles are not doing their job of supporting and stabilizing the joint, and over time that extra stress leads to inflammation, cartilage breakdown, and pain. Especially at night when the joint has been under that unprotected load all day. I had a patient, a 68-year-old retired postal worker named Gerald. He came to me complaining that every night around 2 in the morning, he would wake up with a burning sensation behind both kneecaps. He had been to 3 different doctors. One told him he needed a knee replacement, another prescribed anti-inflammatory medication that upset his stomach. The third told him to just rest more. None of them asked him about his quadriceps. When I examined Gerald, I found that his quadriceps strength had declined by nearly 40% compared to what it should have been for his age. His knees were not failing. His muscles were failing his knees. I started him on seated knee extensions every night before bed. Here's how you do it. Sit on a sturdy chair with your feet flat on the floor. Keep your back straight and your hands resting on your thighs. Slowly extend one leg out in front of you until it is completely straight. Hold that position for 5 seconds. You should feel the muscle on the front of your thigh tighten and engage. Then slowly lower the leg back down. Do this 10 times on each leg. The key is slow and controlled. You are not kicking, you are lifting with intention. A study published in the journal Arthritis and Rheumatology followed over 300 adults over 60 with knee osteoarthritis. Those who performed daily quadriceps strengthening exercises reported a 32% reduction in nighttime knee pain after just 8 weeks. 32%. From one exercise. That is not a small number. That is the difference between waking up in pain and sleeping through the night.
You know, doctor, conversations like this one make me think about something I came across a while back. It is called the Senior Body Reset After 60. I have to be honest, when I first found it, I was not expecting much, but it completely changed how I think about aging. It covers exactly what we talk about on this show: how to reset your body's natural rhythms after 60. Better sleep, stronger circulation, sharper memory, more energy throughout the day. And it does all of that through daily habits, not medications. No complicated routines. Just clear, practical steps backed by the same kind of medical thinking we explore in every episode. If you are someone who wants to take what you hear here and actually put it into action, this is a resource worth looking into. The link is in the description and in the pinned comment below. Now, doctor, please continue.
The second exercise is the lying hamstring stretch. And John, this one is critical because most people completely ignore their hamstrings when they think about knee pain. They focus on the front of the knee, the kneecap, the cartilage. But the hamstrings, which run along the back of your thigh, attach directly below the knee joint. When those muscles are tight, and they are almost always tight in people who sit for more than a few hours a day, they pull on the back of the knee. That constant tension compresses the joint. And at night, when your body tries to relax, those tight hamstrings do not let go. They keep pulling, they keep compressing, and that is what creates that deep, aching pain behind the knee that so many seniors describe. In Korean medicine, we have a saying, "A river that cannot flow will turn to mud." The hamstrings are like a river. When they are flexible and elastic, they allow the knee to move freely. When they are stiff, everything downstream suffers. Here is how you do this exercise. Lie on your back on your bed, keep one leg flat, bend the other knee and bring it toward your chest. Then slowly straighten that leg toward the ceiling as much as you comfortably can. You do not need to get it perfectly straight. Just go until you feel a gentle stretch along the back of your thigh. Hold that position for 20 to 30 seconds. Breathe deeply. Then slowly lower the leg and repeat on the other side. Do this 3 times on each leg. I had a patient, a 72-year-old retired librarian named Margaret. She told me she had not slept more than 4 hours straight in over 2 years because of knee pain. 2 years, John. That is over 700 nights of broken sleep. She had tried everything. Ice packs before bed, heating pads wrapped around both knees, pain patches from the pharmacy, compression sleeves she ordered online. Over-the-counter medication every single night. Nothing worked for more than a few days before the pain came right back. When I assessed her hamstring flexibility, she could barely lift her leg 30 degrees off the bed. Her hamstrings were so tight they were essentially pulling her knee joint apart every time she lay down. I taught her this stretch. Just this one stretch, done every night before bed. Within 3 weeks, she called my office and said, "Dr. Lee, I slept 6 hours last night." I cried when I woke up because I could not remember the last time that happened. That is the power of releasing tension before sleep. A study in the Journal of Physical Therapy Science found that seniors who performed hamstring stretches before bed showed a significant decrease in nighttime knee stiffness and reported improved sleep quality within the first month. The researchers concluded that hamstring flexibility is one of the most overlooked factors in nighttime knee pain management for adults over 60. Now, the third exercise is the one I consider the most important of all. And I say that because it addresses a problem that almost no one thinks about. It is also the simplest exercise of the 3. I call it the pillow squeeze. You take a regular bed pillow, the same one you sleep with, and place it between your knees while lying on your back. Then you gently squeeze the pillow with both knees and hold for 5 seconds. then release. Repeat this 10 times. That is it. It sounds almost too easy to work. But let me explain what is happening inside your knee when you do this. The muscles on the inside of your thigh, called the adductors, play a vital role in stabilizing the knee joint from the inside. When these muscles are weak, and they weaken faster than almost any other muscle group after 60, the knee tends to drift outward during sleep. This is especially common if you are a side sleeper. That outward drift puts tremendous stress on the medial collateral ligament, which is the ligament on the inside of your knee. Over time, that nightly stress leads to chronic inflammation and pain that people mistake for arthritis getting worse. But it is not the arthritis, it is the instability. The pillow squeeze directly strengthens those adductor muscles. It pulls the knee back into proper alignment. And here is the beautiful thing about it. You are lying down. You are comfortable. You are already in bed. You are simply engaging a muscle group that has been neglected for years, maybe decades. A study published in the Archives of Physical Medicine and Rehabilitation examined 120 adults over 65 with medial knee pain. Half the group performed adductor strengthening exercises daily. The other half did not. After 12 weeks, the exercise group reported a 41% reduction in nighttime knee pain. 41% from squeezing a pillow. I remember a patient, a 65-year-old retired school bus driver named William. He came to me because his wife had told him she could not share the bed anymore. Every night he would toss and turn and groan because of knee pain. He was embarrassed. He felt like his body was betraying him at the worst possible time, right when he should be enjoying his retirement. I gave him the pillow squeeze. Just that. Nothing else. I told him, do this every single night, 10 repetitions right before you close your eyes. He called me 2 weeks later and said, "Doctor, my wife is back in the bed, and I am sleeping like I did when I was 50. That is what happens when you give the knee the internal stability it has been missing.
3 exercises. Seated knee extension for the quadriceps, lying, hamstring stretch for the back of the thigh, and the pillow squeeze for the inner thigh muscles. No gym membership, no expensive equipment, no medication. Just 3 simple movements that target the 3 muscle groups your knees depend on the most. And all 3 can be done in less than 10 minutes right there in your bedroom before you close your eyes for the night. Doctor, I have to say, what strikes me about all 3 of these exercises is how accessible they are. You do not need to be in great shape to start. You do not need to be flexible. You do not need to get down on the floor and struggle to get back up. You can do all of them on your bed or sitting in a chair, and the science backs every single one of them up. I think so many seniors have resigned themselves to the idea that knee pain at night is just part of getting older, that it is something you have to learn to live with, that the only options are surgery or medication. But what you have shown us today is that it does not have to be that way, that the muscles surrounding your knee are the real key, and that with less than 10 minutes of intentional movement before bed, you can start reclaiming your sleep, your comfort, and your independence. I know a lot of people watching right now are going to try these tonight, and I hope they do, because the hardest part is not the exercise itself. The hardest part is believing that something this simple can actually make a real difference. So let tonight be the night you give your knees what they have been asking for. Not another painkiller, not another sleepless hour staring at the ceiling, just 10 minutes of care. If you found this helpful, do me a favor, hit that subscribe button so you never miss an episode. Leave a comment below and tell us which of the 3 exercises you are going to try first. And share this video with someone you love who deserves a good night's sleep without knee pain. From all of us here at the Elderly Health Physician, take care of your knees, take care of your body, and we will see you in the next episode. Stay strong.